Hey everyone, welcome back to New Method Live. And today I have a special treat for you guys. Usually you just have me talking to you during the episode, but I really wanted to bring on a special guest. And I plan to do this every once in a while when I meet a special human because I want to share the special humans that I meet with you guys. So today's episode, I'm going to be introducing Dr. John Spagnola, and I'll tell you more about him. But he's amazing. He's a cardiologist that was trained in conventional medicine, but over time realized that there is so much more than what he was taught in school. So in a moment, I'm going to bring him on. I'm going to introduce him and I'm going to let you guys enjoy the show. So for those of you on Facebook, let me know that you're here to ask questions. My team is going to be looking. If you're watching us on the replay, type the word replay, let us know. On YouTube, don't forget to like and subscribe because it's so kind and it makes us feel so good. And if you're listening on the podcast, don't stop washing your dishes or mowing your lawn. Of course, my hair always looks fabulous. I'm wearing a gray sweater. Dr. Spagnola, which I'll introduce in a moment, is wearing a white coat, a lab coat. And as always, I'm wearing a stethoscope that my wife bought me. So today we're going to talk to Dr. Spagnola. Let me do a brief intro on him. He is so humble that he sent me like 2 sentences. Dr. Spagnola is an interventional cardiologist based out of his native borough of Staten Island. He is the Associate Director of the Cardiology Fellowship at Staten Island University Hospital and an assistant professor of cardiology at Hofstra Zucker School of Medicine. He completed his training at SIUH and Lenox Hill Hospitals. Clinical areas of interest include cardiac prevention, cardiac imaging, cardiogenic shock, and coronary interventions. So he's a total lightweight. Welcome to the show.
Thank you so much for having me. I'll please, this is like an awesome conversation I know we're about to have amongst friends. So this is going to be so cool.
Oh my God, this is so exciting. So I just want to tell you guys how I met Dr. Spagnola and why I wanted him on my show. So I was working with a patient, a younger patient, and I gave him some advice regarding his cholesterol. And this patient and his father called me back and said, you know what, our cardiologist does not agree with you. And, and I was like, okay, well, let me talk to your cardiologist. And I was really nervous. I was nervous because I was like, oh, I'm into this functional medicine stuff. And this cardiologist is going to be conventional medicine, is going to like chew my head off for doing this. And so I picked up the phone like I was 12 years old. I was like, hello, Dr. Spagnola. I really did. And this is what he said. Oh my God, I'm so excited to talk to you. This is great.
I remember this day and I was like, and because the patient's dad had texted me and he was like, is it okay if you guys talk? I'm like, absolutely, please, it's encouraged.
So actually we didn't disagree. The messaging got crossed between the patient and us, and he was like, actually, I think everything he's doing is great. Let's go out for dinner. And so we did.
And here we are.
And here we are. And Dr. Spagnola and I went out for dinner with both of our wives' blessings. And it was discovered that we are kindred spirits on the topic of medicine and health. And it is very rare that we have someone who is so entrenched in conventional medicine. I mean, you've gone to schooling and more schooling and more schooling, and then to suddenly kind of see the light and come over to this side. So tell me a little bit about that.
So from like ever since I wanted to go like into medical school, I always like thought heart stuff, and I'd always thought that this was going to be something that I wanted to do. I have like familial heart disease in my family, so it was something that I had always kind of wanted to get more interested in. And it was always like the part of medical school that wound up interesting me. And then I started my training, and I was really into coronary interventions. So I am the guy that gets called in the middle of the night to put stents in people who are having heart attacks. I love it. I know that sounds like a totally psychotic thing to love, but I deal with the sickest of the sick, and I deal with them when they're when they're at their worst, and they get better, the majority of them, and they get better pretty quickly. So from like a reward standpoint, it's absolutely rewarding. But then I started thinking, wouldn't it be great if this just didn't happen? And this was before I was waking up in the middle of the night to like go and do this.
Imagine prevention. Wouldn't it be great if we could prevent this?
Exactly. So
crazy concept.
Totally crazy concept, especially, I don't know, I feel like an American diet is not exactly conducive to this in any way, shape, or form. So I did a deep dive into like prevention and doing this, which I get it. Like the conventional person who's watching this is like, dude, that's bad for your business. But like, I don't care. I don't want it. Like, people are going to have heart attacks, like regardless of whatever you do. But we can reduce the frequency, we can reduce the magnitude, we can reduce the overall number. And Staten Island's a pretty unique place to kind of practice for that because there are an obscene amount of heart attacks on Staten Island. I think we get like,
Wow.
yeah. So we get about, I think last year we did 120 like emergent heart attacks, and then you have like the minor heart
Wow.
attacks, which are like, yeah. So for an island of 600,000 people, it's a lot. And I don't know, kind of forced me to do a deep dive into A, what was wrong with my lifestyle, and B, what was wrong with a lot of the lifestyles of the patients that we had kind of dealt with. And how can we manage that? How can we mitigate that? And how do we form a partnership? And that's really how I look at this. And the partnership is not just between me and you because we have a bunch of mutual patients, but it's also it's with your patients too. And that's I kind of look at our role as educators as and
Yes.
not really dictators in terms of how I want to practice medicine. I know this is like totally weird and off and totally off
It's
base in
crazy. It's
terms of like,
absolutely insane.
I know, but it shouldn't be.
I know it shouldn't be. But you told me that something happened and you read like an article or something, you stumbled upon the concept of inflammation.
Yes. So I remember this patient very vividly. She was a lady with lupus. I had seen her like multiple times in the hospital, and no one took her chest pain seriously. They just thought that it was because of oh, she has a chronic inflammatory state.
Mm,
And one day, like one admission, we finally brought her up to the cath lab, and she had horrendous coronary disease. And so I was like, her cholesterol's fine. All of her other risk factors are managed well. So, like, what led to this? She had no family history of anything cardiac, and it just it forced me to do a deep dive into inflammation, into cholesterol management, not just management, but also metabolism, and how all of these things play a much bigger role than we were taught in medical school. Like, to me, the craziest thing about medical school is like they do not teach you anything about diet, nutrition. They just tell you to send people to a nutritionist.
yep. Yep. Absolutely.
And it just seems bananas to me.
It's bananas. So you discovered this, you discovered that in her case.
She wasn't eating horrendously. She was actually very big into diet and into prevention in terms of like minimizing her symptoms that she was getting from her lupus. And at the time, I didn't pay it any mind. I was like, I have no idea what that is because, again, nothing to that point in my training
Yes.
or experience had led me to do that. And since then, and I'm happy to say that there's been a big growth in, especially within the cardiology community, into exploring this, into exploring, what are all these inflammatory pathways? What are all of these things that could potentially contribute to this? And a big piece of that is so every single patient I see, I talk about diet, exercise, sleep. And sleep
Yes.
was like
Yes.
another new concept that
Oh
I had kind
yes.
of.
Wait, I'm gonna talk about sleep. I just did actually a TikTok and I said, if you're out here eating gluten-free ice, but you're not sleeping, it's not gonna work out for you.
No,
It's literally
nothing
it's
works.
not gonna work. Nothing works if you're not sleeping. But
And
now they're looking to inflammatory. But when you discovered this, I think you told me you were like, oh my God, I kind of stumbled on the fact that inflammation is the thing. And I think you told me you found another colleague.
yes, so I found another colleague who would kind of who was into this, and he was like, "You need to read up about whatever Valentin Fuster is doing is going into." And he's like the world's cardiologist. He's like from Catalonia, Spain. He's like the director of all of all of cardiology for Mount Sinai Hospital, but he's very big into prevention too. So I just started absorbing as much of this as I possibly could, and I would take and read articles from wherever, whether it was a nutrition journal, whether it was from, frankly, up until like the last couple of years, not a lot of cardiology
Nope.
journals either.
I want to interrupt you for a moment because it's really important. What you said is so significant because for those of you listening, you get frustrated with your providers, but we did not learn this in school. And when I tell my story, also when I first started primary care, people came in and said, well, I don't feel well. I'm like, well, your labs are fine. Have a nice day. And in your, like, I can't help you. Everything's fine. We're not anemic. Your thyroid's good. See you next year. And you have to make a decision. Something has to spark you, and you have to be crazy enough to keep studying, right? So you spend your spare time reading these articles. I spend my spare time going to the vortex of functional medicine. But the people who come with, once you kind of open up Pandora's box, you can't unsee it.
No.
You can't. But it also requires a certain amount of dedication on your part, because you're spending time reading things that are not, putting money in your pocket. They're not changing anything for you. You could be like, no, forget it, I don't care. But you care so much that you spend your time reading this. And that's really, I just wanted to stress that for a moment. I don't want to gloss over it.
No, and I think it's a big thing. I think our primary role as providers is to care. And I'm not just talking about a lab value. I'm not just talking about, fixing something and then, oh, great, like you're fixed, you're fine. Like you need to take care of people, and you need to take care of patients. And that's, I don't know, that's kind of what is at the core of me. I mean, I get it. I'm pretty
Yes.
early on in my career, but I've been this way for 36 years. I'm not changing. Like this is just who I am. Before I like went into this, I thought I was going to wind up going into finance. It just wasn't fulfilling.
Mhm.
And luckily now I have a career where I can treat people from prevention through intervention and kind of get a full sense of what everything is like.
So how do you manage that? I'll tell you what I mean. I just did an episode about why the healthcare system is designed to keep us sick, and not in a conspiratorial way, but the fact that the healthcare system is designed for codes. Did you do a procedure? Did you do the thing? Put the code in. And there really is no coding for spend time with a family and figure out what they're eating, spend time with, there's no real room for prevention and spending the time on things that you said, sleeping and eating. How do you manage to do that within the constraints of the system?
So I have very understanding partners, and
That's the key right there.
it's the key. And I'm not just talking about my wife. I'm talking about like the people who I work with every day. So like they hear me go on about my spiels and my rants, and I spend extra time with patients. And I get it from a cost and income thing. Like we get paid the same amount whether we talk to you for 5 minutes or whether we talk to you for an hour. Doesn't make a
Exactly.
difference. But changing you and changing how everything plays into, we're going to get into cholesterol, I promise everybody.
Yes.
But but to make real change, you have to spend time with people. And I like the relationship aspect of it. I like getting to know my patients. I ask them about their families. And to me, it's like, how do you trust me if you meet me for 15 minutes?
Yeah,
Uh,
it's
uh,
so true.
and
Trust me with your
so,
heart.
yeah.
It's not,
So like,
it's not your
I was
foot,
on.
it's not your toe, it's your heart.
So like, I was on call for heart attacks yesterday, and this is just a funny story like from today. So I spent like an hour talking to him, and his story like today, like yesterday, like while we were doing all these things, I was not asking him about his family. I was like, I just need to open your artery, and like we're gonna be fine. But I spent like about 45 minutes today, like in between procedures, and was just chatting up this guy. He's such an amazing person. But when I was walking out of the room, one of the nurses was just like, "Wow, you were in there the whole time," and I was like, "Yeah." He was like, "Oh, you must have really examined him." I'm like, "No, we were just chatting.
We're just
Just wanted to
talking.
make sure he was okay. Just talking. Wanted to hear about his family. He wanted to see mine. We exchanged pictures. He has grandkids. I have children. So we were, and I don't know. That's how you. To me, what's going to make a bigger difference in this guy's life? Yes, I get it. Opening up his artery, fine. But what is going to make him want to talk about these other things? That's not my goal. For me, this is how I get fulfillment out of this too. It's not all just selfless. But he's gonna make real changes to his life,
That's
and
amazing.
it's cool.
Yeah. I mean, not to sound all woo-woo, but there's a higher power. There's a higher calling, there's a higher power, and that is the driving force for you and everyone on. And that's not to say people in convention medicine don't care. Of course they do. But to make that leap and to dive into it and then to change your practice because of it, I've done the same. Um, it's just, you're just answering to a different calling. And if you think about it, like financially speaking, it's counterintuitive because you're doing everything you can to keep them off your table. so, so it's counterintuitive, but it actually works because people come to you because they love you. So good. Okay, so the topic I really wanted to talk about is cholesterol because there is so much nonsense out there about cholesterol. So let's start with just a refresher because not everyone knows, what cholesterol is, what we believe, and why we think it is, the thing that we have to watch out for heart disease. Let's talk about like the before you discovered what you discovered.
So I cholesterol was always kind of known to be this. I don't want to say always. This is like all like the last like 40, 50 years. But cholesterol was always known to be a risk factor. And it started off as an association, the way we kind of view everything. And then the research kind of evolves through that. So we noticed that everybody was having heart attacks, had high levels of circulating cholesterol, more so their LDL or their bad cholesterol. And if they had higher levels of their HDL, people seemed to do better and had less risk of atherosclerosis. And basically, it's lipid byproducts that are swirling around in your blood, schmutz, for lack of a better term
Schmutz, I
for
love it.
it.
Cholesterol schmutz.
It's cholesterol schmutz. I don't know. I'm from Brooklyn. This is just how I talk. um, and that those circulating particles are what we've come to know recently are that they are very pro-inflammatory and they get activated and oxidized whenever there are free radicals, reactive oxidant things that are
Wait,
going
wait,
on
wait.
with.
I'm
Yeah,
gonna
yeah,
I'm
yeah.
gonna stop you
Go
there
ahead.
because using big words, and I want to make sure everyone's clear with us. And we
Gotcha,
also made
gotcha,
the
gotcha.
transition.
Sorry.
So first, for me, not for my audience is super smart. I just need things broken down. So um, I just want to first say that what you're saying, and I don't want to gloss this over, is that you had people who were having heart attacks,
Yes.
and you happened to find out that that elevated cholesterol. So a decision was made that, oh, this must be the reason. It must be the reason that if we see high levels of cholesterol, therefore we're having heart attacks, right?
Correct.
That was the connection. And so this is why we're all chasing to bring the cholesterol down, because this must be the reason. We made this link. So that is carried us over, still carries many people, but you're saying that what we've discovered recently is that it's not the cholesterol, but rather, what is it?
So it's the cholesterol plus the inflammation, and whether or not the cholesterol that's circulating, and inflammation could be from anything. It could be from infections. Stress leads to extra inflammation in your body, and I hate labeling stress as a risk factor for heart disease, even though we all know it. But it's such a subjective term. Like, I don't know. We all respond to situations differently, and we all can handle certain things in different ways. But our bodies handle things in different ways too, to different extents. So there's no way that I can say that my stress is different from your stress or different from somebody else's stress. But it's there, and we know that it definitely plays a role. You can kind of test this by looking for inflammatory markers and in blood work. And recently, we've identified a few that are more specific for heart inflammation and kind of lead us into that realm. But there's inflammation that you're getting from everything: your diet, chronic inflammatory conditions. Like, to date, like, I would love to see rheumatoid arthritis, lupus, believe it or not, even like HIV, because you literally have an infection that's swirling around in your body for forever, even if it's managed well, but it's still a chronic inflammatory state. And all of I would love to like group these together and get the research and know that, because we see it in clinical practice, but it's not like one of the traditional risk factors that you think of. But the commonality between all of these different risk factors, whether it's high blood pressure, whether it's diabetes, whether it's stress, whether it's diet, whether it's cholesterol, is inflammation.
100%. So are you saying that if two people have the same cholesterol number, but one of them has less inflammation, they will have a lower risk factor than someone with inflammation? Whether or not we can quantify that right now, but is that what you're
Yes.
saying? Okay.
Bringing down your inflammation will decrease your risk for heart disease, period.
Period. Exactly. And anyone who's watching me knows that everything I talk about is inflammation. So if I had to choose my specialty, it's inflammationology. Uh, inflammation. I think that's a good word.
I like it.
Thank you. Because like you said, I treat patients now all over the country. and I should say I coach patient because I can't, take care of them across state lines. So I coach patients all over the country, and they come to the table, like you said, some of them with RA, some of them with lupus, some of them with Crohn's, and some of them just aches and pains. And they've all been told, by the way, kind of like your lupus patient in one form of another, that, oh, it's all in your head because, it's all in your head. Yeah.
Nope.
No, sorry. And the common denominator for all of them is inflammation. This is why I can work with them in a methodical way, because our goal is to reduce their inflammation. And when we reduce the inflammation, oh my God, the aches and pains go away, their flare-ups go away, their skin gets better, their headaches get better. And it turns out, based on this conversation, that we've also lowered their cardiac risk.
Without question.
Without question.
And it's interesting now that my lens has kind of changed. I noticed that the traditional risk factors also lead to increased inflammation.
There we go.
So people who have uncontrolled diabetes, whether it's with medicines, whether it's with diet, like also higher risk of inflammation. And of course, that's going to affect your coronaries because inflammation is the common denominator. Same thing happens with high blood pressure. Same thing happens with stress. Same thing happens with the different types of food that you may eat. Now, I'm going to have full disclosure. My favorite food is cheese. I do not have it every day because of what I know. It can possibly be the worst thing you could have for yourself. But I got to scratch the itch. I'm sorry.
That's okay. I tell my patients that it's okay to live in the gray because it's really hard to be 100%. So you stay as tight as you can and then enjoy a moment and then you hop right back on. It's okay. It's never black and white.
That.
Never black
No, and you got to like, I'm doing this so you can live. I don't want to get in the way of you. And living to me is, what happens between visits. Living is, I want you to feel good. I want you to mentally be good and be well. But I also want you to enjoy yourself. I'm not doing this so that way you cannot enjoy yourself. Do this like I will fix you. But you got to fix yourself. And I want people to enjoy themselves. And I don't want people to think that yes, because I have X diagnosis or Y diagnosis, I can't enjoy. You have to.
Yes. So we just don't need to do it every day, every meal.
Exactly.
I think that's the difference. So, I tell my patients all the time, and I purposely also post it on my social media when I'm out with my family to show people I live a normal life, because it is not possible to be regimented all the time. But if you're 85%, 99%, that's pretty damn good on the inflammation scale. Yeah.
The majority of people live in the opposite direction, where they're good 5% of the time, 10% of the time, and then 95% of the time, it's just total chaos.
It's total chaos. It's total chaos. And by the way, I'm glad you mentioned stress. And yes, it's subjective. And there is nobody who has a stress-free life. And that's definitely not what we're saying. It's really about learning how to manage your stress. And it's not my area of expertise. So whether that means going to therapy or whether it just means taking a moment, going outside and inhaling and exhaling, because we forget to breathe sometimes.
Seriously. Or just let out a primal scream if you have to too. Like for me, that's very therapeutic.
So that's what we mean when we say managing stress. We don't mean live a stress-free life. It doesn't exist.
It's not possible.
Not possible. But tell me what you discovered also about sleep, that you happened to mention it.
So sleep to me, so I ask everybody like a laundry list of questions, and I forewarn my patients before, and I'm like, I'm about to ask you a bunch of weirdo questions now that you didn't come here for. So I always ask, describe a regular day to me from the time you wake up until you go to bed, and then I fill in the gaps with the things that I really care about. But the things I'm looking for are, what is your support structure like? What do you eat and when do you eat? So I think the when you eat is also very important as in addition to what you eat. But then I also talk about sleep quantity and sleep quality. So the easiest way for me to ask is, do you dream? So I ask, how many hours do you get a night? And then I ask, do you dream? And then it usually leads, I've had some weird answers to that question. It's a great question.
That's a good question. Don't tell me your dreams. I just want to know if you dream.
No, they all tell you their dreams after you. Like, you're gonna get that like afterwards. But when people dream, they go into a deep sleep or REM sleep, and I liken it to, it's your body rebooting in safe mode. But in terms of rebooting, but it reboots everything. It reboots your metabolism. It reboots your inflammatory cycle. It reboots
Yep.
and recharges you for the day after. So it's, to me, it plays a huge role in overall body inflammation. And in addition to that, overall, I don't want to say health, but well-being. Like people who sleep 6 to 8 hours a night and get good quality sleep, typically feel better in the day. Like I don't know
Absolutely.
how else to describe it.
And I want to add two more things to that. So, and I'm sure you know this, but for those listening, your brain is so metabolically active. So think of a city and there's a lot of hustle and bustle. At some point, somebody has to pick up the garbage. So this metabolic waste has to be cleaned up, and that happens at night. So growth hormone, which is when we're little, makes us grow, but when we're adults, it actually repairs, is released at night when we're sleeping. But if none of this matters to you, all you have to think about is this: when you miss one night of sleep and you're super grumpy, that's obvious to you. And if over time you're missing a little bit of sleep every night, you're just kind of you're losing your edge over time. And suddenly you look back and you say, wow, I'm not as sharp as I used to be. And part of that is because for the past 20 years, you haven't been sleeping. So it's a big part of it. And I don't know if you're familiar with some work for Alzheimer's, but whether we're talking about prevention for Alzheimer's or reversing of some symptoms, sleep is mandatory. You cannot reverse the symptoms of dementia if there's a possibility of reversing them, or prevent it if you're not sleeping, for precisely these reasons. That's big. And then you mentioned when they eat. What did you mean by that?
To me, the biggest thing is having a fasting window before you go to sleep. And
Yes,
it's really, and I say 4 hours. You're the expert in this, though.
I mean, a minimum of 3 hours. I agree with you, from
There you
when
go.
you last eat to when you go to sleep.
And to me, it's basically it's about how your body processes the food that you eat and the nutrients that you get and where it's going to go. So if you give yourself 4 hours, you will utilize that energy that you've taken in, as opposed to if you have a carton of ice cream and then you go to bed. All of that is just going to go into your fat stores. You're going to be inflamed all night. You're not going to get good quality sleep,
Not sleeping.
and you're going to feel like crap the next day.
Yeah,
Now,
you're
look,
gonna
you
feel
can
like
do
crap.
that sometimes, but if you do it
Yes.
every day, it's a problem.
Exactly right. Exactly right. And then you also mentioned relationships, and that support structure is so important. One of the things that happens to our elderly, one of the reasons that they go into cognitive decline, among other things, is because of social isolation. And
Completely agree.
and we tend to look at like that, and you're like, well, that's not me. But if you're slowly isolating, going out less and less, interacting less and less for whatever reason, before you know it, that person you're looking at becomes you, and you're suddenly socially isolated. And that has such an effect on your health. Again, one of the things we never talk about.
Yeah.
You,
And so my grandma's 86. I love her.
yes.
But she's had like some freak health issues this year, and she's been like very, very, very isolated, and like almost, she's fine now, but like during like the time where this was, like she exhibited a bunch of like very needy behavior, and I didn't really understand it. And I think a lot of it was just she was totally independent, and she threw out a back. I'll say it. Okay. But she
We love you, Grandma.
love you, Grandma. Margie, great. But she had a big issue with like finding her motivation because her independence was gone. She lived like a very social life. Like she would go out to like lunch with like all her friends like every single day, like the whole week. And I don't think it was conscious, but she started needing like her body was craving that human interaction. And I think if this had gone on longer, like I think that the natural progression of this would have been that she would have had some cognitive decline and had issues like that. And like it's easy to see how these things can start.
Yes.
And part of it is family dynamics changing, different situations with other portions of your health, and I don't know, it's scary.
Yeah. So if you were taking of someone elderly, make sure they stay connected, get them in a group. They're not going to want to go, take them anyway. It's going to help no matter what.
Even just call them.
Call them. Yeah, call them, bring them to dinner, let them sit there, even if, sometimes they don't have much to contribute, especially if there's a lot of different generations at the table. That's okay. The neurons are firing in the presence of the younger generation. You bring them in. It's so important. I just want to say this before I let you go is that, a lot of times people say to me, is this alternative medicine what I'm doing, functional medicine? And I'm like, absolutely not.
No.
Because all of our guidelines, every single guideline that you read in your Hippocrates or up to date, the first thing says lifestyle modifications.
Yep.
And then they talk about the medication. It's just that in our industry, we skip the lifestyle modification and go straight to medication. And I think where you and I are, it's not alternative. Of course, if you need medication, we're going to give it to you.
This is first line.
But the first line therapy of every disease is lifestyle modification. Tell me why we skip it.
So I think this probably has to do with what you were talking about before, where like, the care and medicine is gone. And there's always so many things you could tackle in a 15-minute visit.
Yeah.
And we are, and like, however the medical industry is situated, like we've arrived at this point. So, and I don't think it's unique to lifestyle changes. I think historically, the way that we responded to pain, like, 15 years ago, there was no fifth vital sign, which is, you have to assess your pain at every visit. Also 15 years ago is when pharmaceutical companies came out with opioids. And you're not going to sit there for 15 minutes trying to examine why everybody has back pain. Half of all medical visits are related to some form of back pain, which is
Sure.
bananas.
Bananas.
So,
maybe it's because we're sitting so much. No. Okay.
No, probably. So I think in a 15-minute visit, you could say, oh, like you should try to do these exercises, blah, blah, blah. Or you can just give somebody a pill that's going to make their feelings go away. And I think we got complacent in that. Not to say that certain people don't need pain medicine,
Of course.
or certain people don't need, cholesterol medicines, which I do want to touch about what different medicines and different things we could do, but we'll get there. Oh no, we're good on time.
Oh, we're gonna time. We could talk about cholesterol medicine right now.
Totally. All right. So
it's all right that we're switching around. Our listeners can handle it. They love it.
This is how
going.
my brain works.
I'm
always
you.
in like 20 different places at once. So like a train of thought could just be in one direction and change.
So are you about to talk about statins? Is that what you're going to talk about?
Yeah. So
let's do it.
There's like 22 different types of cholesterol medicine, and they all lower the number, which is great. But we don't treat people. We don't treat numbers. We treat people. So you can get that.
You treat people. Everybody else treats numbers.
Well, I don't want to lump everybody in the same.
Okay. Fair.
But you're right. For the majority of people, we just look at the number, and the number is what we've been conditioned to look at. And yes, there's a goal, there's a this. And I think the community is starting to kind of wrap their heads around this, and like, because we used to just treat a number. If it was over a certain number, you got to get it under this. If you have certain risk factors, we got to get it under this. We've gotten such a better appreciation for what are markers of risk, and markers of risk could be age is like the biggest marker for everything, not to seem like an ageist, but the older you are, the more likely you are to have things go wrong. Human beings are not designed to live beyond 65 years old. We routinely do. But
we're pushing our luck every day.
We are. And I know that sounds like I don't know. I always think of everything that we do as kind of anti-Darwin, but that's a conversation for a different day.
Because we keep outliving when there's no.
I know. I gotta get back on track.
I love that. That's okay. Another episode. Survival of the fittest, episode 2. Okay.
So when we talk about these new risk factors, and so inflammation is a part of it. So a high sensitivity CRP is a measure for inflammation in the heart. Then you can also see if somebody has plaque in a non-invasive way by doing things like a calcium score, by doing a CAT scan angiogram of your heart. So we are kind of getting into this mode where we're starting to think about it. We just don't delineate it as clearly as you and I talk about, even though we go off on all these tangents. So out of all these different medications that are out there, lifestyle helps to an enormous degree in bringing down that number. But the number is what we've come to realize is a piece of the equation, but it doesn't tell you the overall picture of what's going on within your vasculature, whether that's to the brain, to the heart, to the legs, and kind of doing further investigations into this and knowing what can kind of change that plays a role in which different pharmacology we use. We have to talk about statins. So out of the 22 different cholesterol medicines, statins have these vague anti-inflammatory properties, which if you got nothing out of this podcast is inflammation is the key to all of this. The rest
Okay,
of them
wait.
treat them, go ahead.
I gotta stop. I'm sorry, because you say it fast and I want my audience to appreciate it, because you sent me these articles and it actually blew my mind. It took me a long time to read them because there was a lot of big words, but
Yeah,
it
was hard
was
for
like
me to
looking things
digest too.
Okay, good. I was like, oh my God, enough coffee, but I read them. And here's the thing that I really got from it. So the statins, it came out and there was this conversation like, hey, they reduce cholesterol. So we use cholesterol. Great. If that was the case, and if it was just about reducing the cholesterol number, then it should be some time before we see an improvement in what's called, the rate of morbidity, the likelihood that you'll die. It should take some time for these things to work. But what they discovered is that they were working pretty fast and that they were reducing morbidity, the risk that you might die rather quickly. So how is it possible that if this is just about not producing more cholesterol, that it's working so quickly? And what they realized is that while yes, it is part of the cholesterol building mechanism, but what they realized is that these statins work because they're anti-inflammatory. So taking these statins, thinking it's like some sort of cholesterol, I'm gonna say buster, not really, but in fact, they're just anti-inflammatories. And if you just did the anti-inflammatory thing, you wouldn't need the statin with all of its side effects. That's what you're saying, right?
Yes. So like for primary prevention, without question.
Okay.
For things like this is if you've had a heart attack, if you have stents, if you have these things, the long-term patency of these has been well studied over like the course of like the last 30, 40 years. So like those are the people who I will try to keep on these as long as possible. I will lower the dose at like to the minimum that you even have to do it. But for prevention and to kind of get out of this, which is my jam, nip it in the bud early. Lower your inflammation, change your eating habits, do all of the things, because the end result could be gnarly.
So you're saying kind of like there's two groups of patients, right? There's a group of patients who already had an event or are very likely to have an event. For those people, yes, medication statins are going to be part of the picture because yes, anti-inflammatory, but also we have to make sure we're not building any kind of plaques or anything because there was already an event. So why are we messing with it? But for those of us who have not had it and we're just dealing with cholesterol, consider the fact that if you're being put on this medication, one of the reasons it's working so well, one of the reasons is because it's an anti-inflammatory.
1000%.
Yes.
And any way that you can do that. I don't know, diet has played such a heavy role in this. I don't know, I've become a lot more plant-based, just based on thinking about all the research that like I've like personally done into like this field. I do intermittent fasting, which I understand is not for everybody. For me, particularly, it works pretty well. And I still enjoy myself, but I keep a close eye on everything. I need to kind of make sure. And I feel it when
you overdo it. Yeah. So just a quick recap, right? So intermittent fasting has, I just did an episode on this one. I was like, intermittent fasting is not about weight loss. Like, yeah, you might lose some weight, but it's about being anti-inflammatory. Bottom line. It's why the aches and pains go away. It's why you're clear-headed. It's why it's better for your heart. Anti-inflammatory. And then you said plant-based. I have my reasons of why I think plant-based with some animal protein. When I say plant-based, I don't mean vegan or vegetarian. But what do you mean when you say plant-based?
So for me, I try to stay away. So the easy things whenever, because we have limited time to got to talk to patients, I'm like, look, these are the things that are bad for you. But if you can become more plant-based, try to decrease your animal fat products that you have, like saturated fats are like one of the worst things you can do. They're this is like the saturated fats could be like the nexus of this lecture. They're pro-inflammatory and they're pro-cholesterol factors. So if you can minimize those, as well as promoting your intakes of unprocessed fruits, vegetables, nuts, berries, while also getting in some animal protein. Like, I love fish, I love chicken. Try to stay away from red meat as much as you can, but like, have a juicy steak if you feel like it every once in a while. Not
Yeah.
telling you to do it every day, but and there are people who do. But
Yes, there are people who
uh
do. So I'm
but
more on your page. I tell people, eat the rainbow, not Skittles. Look at your plate. Make sure you're purposely choosing color, because each one of those colors has a phytonutrient. So, you know, go outside of your comfort zone. Eat the weird bok choy or something that you wouldn't usually eat. Everything sauteed in garlic is delicious. And then,
yes.
and then have a piece of animal protein, unless you're ethically against it. And I think that's kind of like the ideal. There are some cardiologists out there, functional cardiologists. I'm purposely saying cardiologists because these are people who are well versed as you are, but they're in the functional world, who are actually more pro carnivore. And I have yet to figure out why. I look forward to talk to them. Just want to say it out there for people. It's not where I stand. It's not where Dr. Spagnola stands, but they
No.
do exist. So, but I'm also not saying vegan vegetarian, because I have to tell you, I have a lot of vegan vegetarians who are coming in diabetic because they're eating potato chips all day.
Oh, you could. I think this was your line, and I love. When we had dinner the first time we met in person, and you were like, "No, you could be vegan and you can eat Oreos all
Yeah,
day."
you're vegan, but yeah, exactly right, and be full of inflammation and all these other things. That's amazing. Okay, so I want to wrap this up because I know you have to get to your family. So I'm going to put, of course, in our links at the end of the show, where you can see Dr. Spagnola. Dr. Spagnola works, for those of you who listen to us nationally, unfortunately, he only works in New York and in Staten Island. So if you want to see him, you got to come in here. But for those of you who are local, he takes insurance. So hurry up and get there.
Any and all, I have to treat everybody.
Andy and all. He's amazing. But do you have any message or anything that you would want to leave the audience with? I know I'm putting you on the spot, but let's try it out.
Um, I, I think if you want to talk about prevention, I definitely think we could talk about that if you want to as a patient. It's a big part of everything that I do, which I think is why you and I work so well together, because we talk about a lot of these things and a lot of interesting patients, like and management decisions. I don't like the idea of cookbook medicine, and we've kind of
Mm-hmm.
gone too far down this road. But the only way you can really get individualized care is if you have individualized relationships with your patients. So again, all of these things kind of play a role hand in hand. And like I said, myself, my partners are all along the same pages with this. And if that sounds like your cup of tea, please come and see me. Would love to chat with you, whether it's about cardiology, whether it's about this. But talking about a healthy lifestyle, I think an ounce of prevention is worth more than a pound of treatment.
Amen. I love that. Thank you so much for your time. This has been amazing. I really hope you guys enjoyed this as much as I did. I plan to bring on more guests in the future. But until then, if you want to reach me and my team, it's The New Method, and just about every platform except for Twitter, because I talk too much. The New Method is spelled with a K, because you always knew there was a better way. I'll talk to you guys soon.